The midwives at Legacy made me feel really empowered. They really felt like a partner. My name is Casey Mespelt and family of 4. So I have a son who is 2 years old, named Xerxes. I have another son named Killian, who's now 3 months old. My husband and I have lived in Portland, I think about 7 years now. So my first experience with Legacy Midwives was actually my birth with Xerxes. That was my first experience with actually seeing a midwife team in action at a hospital. So the midwives at Legacy at the hospital have all the same resources that a doctor would have. So I think a fear that a lot of women might have going into a midwife group and having different midwives each visit would be that I'm gonna have to explain my same story, my same symptoms every single time I go in. It wasn't like that. The midwives did a really good job of reading through my, portfolio on their system before I came in each time. So my second pregnancy was pretty rough. I had a kind of disorder where I was just throwing up constantly. And then I ended up having some heart issues, but to an extreme where I was just basically couldn't function for 9 months. It being my second, it was really difficult with a 2-year-old. And I'd say the midwives did a good job of offering me interventions, such as like getting IVs weekly to keep fluid within me. They were really good too about checking in on mental health and like, how are you doing? One thing that I thought I would never struggle with was anxiety. And during my prenatal care, I ended up, because of the heart conditions, having just anxiety medication for just a little bit. It was maybe not even a month that I took it, but they were good at saying, hey, that's an option. We have that for you if you need it. And the midwives did a really good job of supporting my birth plan with Killian. We barely made it to the hospital in time. I think one of the first questions the nurse asked me, it's like, what's your birth plan? And I was like, husband, show her. I would definitely recommend the Legacy Midwives to my friends, to anyone giving birth. Midwives in the hospital offer that bridge for people who are really looking for kind of a soft landing to what a hospital can offer.